Tunamelona de alimi coast na lachibe ya ejiwa jisidan community babonana meja tamako etachi ko ma fi asara mo fi tomitro na agwochibe na egwa gubaba ebamboche jamfani bioina.
In 2013, under-5 mortality in Nigeria was estimated at 128 deaths per 1,000 live births, with approximately 54% of deaths caused by malaria, diarrhoea and pneumonia, illnesses that are both preventable and curable. Children under the age of 5 are particularly vulnerable and can die without access to treatment, especially in rural areas where access to the nearest health centre is difficult. Integrated Community Case Management, or iCCM, has been a recommended strategy to improve access to healthcare for hard-to-reach communities. Community health workers for iCCM are trained and supervised to provide timely and effective diagnosis and treatment of malaria, pneumonia and diarrhoea, as well as malnutrition. They are supplied with rapid diagnostic tests and artemisinin-based combination therapy for malaria, respiratory timers and antibiotics for pneumonia, and oral rehydration salts and zinc for diarrhoea.
Children are the heritage of the country. iCCM is like a complete package focusing on prevention and also focusing on curative. And I think that's what our children need so that we reduce the deaths among them.
The strategy of iCCM is meant actually to reach out to the places where the regular health services cannot reach.
The iCCM project is a lifesaver. It's one project that has helped to reduce the number of deaths among the children under the age of 5 and in areas where mothers are not able to easily access care.
In 2012, the Government of Canada awarded a grant to the World Health Organization to support the scale-up of iCCM in 5 malaria endemic countries in sub-Saharan Africa. This initiative was launched in Nigeria in November 2013. Led by the Ministry of Health and working with partners, RAcE was implemented in Niger and Abia states.
amma ile amfani lafiya tsaibu na jama'a ya bai bata ya ji amfani bai na da ma kuma ci dena labe na ma ji amfani sarai to ba gi to zagi ni piwe lafiya ya gishi ngai ba ngai lafiya ya gi gaje lafiya nke lafiya ya yi na je baba ya gishi ne laudan yi refa ba wa lokaci da goga yayi na wa jerike benaci bena bebe da eji ba bona buna kam na cibiya na la beji ba na yake lokaci ga ware shi na wa je cibiya na ajali da be game daga na cibiya na be na wa gwa kan nya je wuce kan.
The iCCM program is specifically to be delivered in those places that are cut off from the primary healthcare centers. For the women who are community health workers in Abia State, you see them receive benefits such as they have social prestige, community approval, they have non-monetary incentives.
One thing that has come out of the iCCM project is the empowerment of the community to own and sustain the service that are being given to them.
The program is unique because it's involving both the community and the health system. With the community resource persons, they manage the under 5 children, and cases they cannot handle, they are referred to the health facilities. So the capacity of the provider at the health facility is also built to manage all those complicated cases.
Oh, you so ko imagine abuna daga na lachi gbenna be daga agwo ya gutawo wona yibani abuna ye jiwala ya asibiti bia ebuna kafi gaga idi asibiti abuna kam na chibe la bia na o iso ye la gwanwe egwa magbani na daga na chibe na be na ha ije bo soko ebo ka lokaci ne fi lokaci ba ko gwani da na ndo ci kaga chibe na dabo na ndo ce le la kafi ye ji fo gutana ye de fili ke bi ko ya amma gbani ide chibe na ije bo soko ije bo ya na ji la chibe na be na.
Between 2013 and 2017, RAcE in Nigeria worked with local government and partners in Abia and Niger states to deliver activities including recruiting and training community-oriented resource persons and supporting the Ministry of Health to implement iCCM.
We've commenced the process to ensure that the 2 states under the RAcE project developed a sustainability plan roadmap, and the roadmap has been presented to the State Ministry of Health in Abia and Niger State. They now have the roadmap that will assist them to scale up the intervention in their respective states. We have scaled up iCCM to other parts of the country. So most states are coming on board to scale up these interventions.
As a result of RAcE, healthcare services were strengthened. Almost 2,700 trained community-oriented resource persons have diagnosed and treated over 1.25 million cases of malaria, pneumonia and diarrhoea.
I think the coming on board of the RAcE project, it's good for the government of Nigeria, because before we make any policy decision, we need local evidence. In Niger and Abia, we now have a local evidence that this is the way to go as it relates to addressing the unacceptably high under 5 mortality rate in Nigeria.
RAcE has been successful in Nigeria because in the areas where RAcE has helped us implement these programs, the child mortality has reduced, and also it has built capacity of the communities. iCCM can work. It can be expanded and scaled up. The solution is simple. It's getting committed community members that could be trained and provided with the medicines and supervised regularly, and this could be delivered.
Right now, one of the best ways in trying to ensure that we improve the health outcomes for our people is through empowering communities to be more aware about their health, and that they can have solutions to these problems.
Amfani machuku kona mi de na me loto ya zaji na mafari o afe ya mi ngichi lati bezo che shinkafa on shijina ba chi o ngai amfani tuko bididi na mi de etikata na to ya mi na jibani idani ngoda na.
Since its implementation in November 2013, RAcE Nigeria has shown that iCCM is an effective strategy for reducing childhood deaths from malaria, diarrhoea and pneumonia, and that scale-up is feasible. We need to ensure that iCCM benefits more communities in Nigeria and across sub-Saharan Africa. Leadership and commitment from governments as well as donors is crucial for this to happen and to continue to save more children's lives.
Bata ida boy 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 che gumi che de boy ande to se jilai